Hey, welcome. I'm Dr. Pete. What is a therapist? How many people ask that? Well, a therapist is an unprotected term. It doesn't even necessarily exist. What does all that mean? It means that all professionals have a license that are protected by the Division of Consumer Affairs. And so while that sounds very bureaucratic, and it is, it also protects the community. So these licenses are really essential to ensuring that you are receiving the proper therapist or the proper training, that the person has the proper training to provide the services that you are receiving. Now what does all that mean? So out there offering the idea of therapy, I often look at it this way. Therapy is a verb, not a noun, right? So there are therapists, but really it's the verb of providing therapy that we're looking at. There are psychologists, psychiatrists, social workers, counselors, and nurse practitioners. Those are typically the top 5 licensed professionals that are offering therapy. I'm going to start with psychologists. Psychologists have a doctorate degree, so it's either a PhD, a PsyD, or an EDD. I think that's almost in every state. There might be 1 or 2 states in the US where you can have a master's and still be called a psychologist, but in most states you have to have a doctorate to be a psychologist. And they're offering therapy or the counseling. Their training is about 100 plus credits of the actual idea of psychology. There's a lot of biological basis of behavior that are studied, and all aspects of the brain as it contributes to one's mental health. In particular, and what makes psychologists a little bit unique in the mental health field is the idea of assessment. Those IQ tests and personality tests, like everyone's seen the ink blot, right? The Rorschach. This is something that psychologists provide, and that's what makes them unique in the field of therapy. Then there's our psychiatrists. Psychiatrists are physicians. They're medical doctors. They went to medical school. They have a medical degree or some other type of degree to practice medicine. And then they specialize in psychiatry. So if you had an issue with your heart, what kind of doctor do you go to? You go to a cardiologist, right? Well, that's the same thing. So if you have an issue with some sort of mental health, really you should be seeking services from a psychiatrist. Now, in terms of what they're providing, it's mostly medication management. And that's mostly because of insurance companies. So insurance companies regulate what they'll reimburse and how much. Psychiatrists are not being reimbursed as much for therapy. And so they tend to lean towards providing medication management. So they will prescribe what we call the psychotropic medications, which can benefit some individuals depending on the diagnosis. But that's for a different video. Then there's social workers. Most social workers will have an advanced graduate degree, so they'll have a master's degree in social work. These are typically people who are people with degrees in social work will often refer to themselves as therapists or psychotherapists. Remember, therapists and psychotherapists are 2 terms that are not protected. So they have a license to practice social work, which the training is primarily in case management and other types of community resources. What I've seen professionally is many social workers will go on for advanced training in other types of counseling or therapy, such as dialectical behavioral therapy, psychodynamic therapy, or the Psychoanalysis Institute. There are many different specializations that are out there that someone providing therapy could have. Counselors have a master's degree in counseling, and the curriculum and the training is based on counseling theory. It's all idea of what symptom can be treated by what intervention, and what is an outcome that is measurable. Then there are nurse practitioners who are advanced practice nurses, so they have an advanced degree, advanced training in practicing nursing, and then they go on for a 1-year psychiatric rotation, which allows them to prescribe medicine as well and offer counseling. Most nurse practitioners will tell you that their training in counseling theory is limited. Some go on for advanced training, but in general, they are focused more on the medical aspects of mental health. All right, so in summary, you have psychologists, psychiatrists, social workers, counselors, and nurse practitioners. Those are the top 5 that you really see of licensed professionals offering therapists. Now I'll leave you with this. You don't just walk onto any car lot and drive away with the first car that you test drive. Usually you test drive a couple cars. Finding your right therapist is like finding your right car. You have to test drive some therapists. See you later.